Here's 11 really strange symptoms that indicate that there's an organ problem going on in your body. So I think these are really good ones to know. Could be suffering with one or two, or hopefully not more than that of these. But these strange symptoms are easy indicators that something's happening. Let's go through them. 11 of these. Number one, right out of the gates, extra hair just for women sprouting up on the chin. Men, I understand, we get this. It's normal. We should get it. But these hairs, women, can be warning signs of polycystic ovarian syndrome, a really big imbalance in the hormone area. And you usually just see a few hairs, but they can be really dark. So if the dark ones are showing up, a little bit of hair, not a big deal, but some dark ones showing up, sort of like what you would maybe see on a man's beard, these are hormonal imbalances, and they can affect your cycle. If you're post-cycle, then it can create even more issues long-term with your reproductive health. So this PCOS, traditionally driven by an imbalance of insulin. So I highly recommend understanding how to balance out insulin. The best tool I know for that is rotational fasting. I put a video on that in the description below. But dark hairs, problems with the ovaries, polycystic ovarian syndrome, look to insulin for your solution there. Number two, dark patches. These could be on your arms or armpits or even on your neck. And it's almost like if you have dirt, like a dirt patch on your skin, but it feels soft, looking almost like dirt, but it doesn't wash away. If you have these dark patches, it's often a sign that you have too much insulin in your blood. There's either insulin resistance, you are pre-diabetic, or you may have type 2 diabetes. And if you are unaware that you have that condition going on, or you may be moving towards that, these brown patches could be a lifesaver to turning that back around, because type 2 diabetes puts your kidneys at risk, puts your limbs at risk because of the lack of the blood flow that goes along with it, also increases your risk in one of the number one driving factors of heart disease. So if you see these darker patches, you're gonna wanna get your insulin levels and your blood sugar levels tested. Fasting insulin should be between 2 and 6. Request your doctor do that test. You can also check glucose, ideally under 100. A1C tells you a lot as well. For these, I would go back to point number one. Rotational fasting is one of the fastest ways to get this under control, to fix the cause of the problem, which is your insulin being out of control. So check out that training. It's in the description. Number three, you see a red spot on your eye. Not a bloodshot eye, not a pink eye, but just a random red spot. And it's kind of regularly occurring for you. This is called a subconjunctival hemorrhage. It's a red spot on your eye, right? But the American Heart Association says that it's really common in people that have high blood pressure or diabetes. So your blood pressure could be up, especially if you're unaware if it is high, or maybe you used to have a problem with it and you're looking for any signs that it's coming back outside of testing your blood pressure. But if you see those show up, it's time to take a good look at your blood sugar levels, time to take a good look at your blood pressure levels. If you are struggling with blood pressure issues, in the description below, I put a hack that can lower your blood pressure in 1 minute by doing it. It is incredibly powerful. It's really cool to see the comments on the video of people that have used that and lowered their blood pressure 10 to 15 points. So check that one out in the description if you need help there. Number four, a swollen big toe. Now, if you don't remember stubbing your toe, then more than likely what's going on is gout. And there is an increase in the amount of uric acid inside of your system. It can be very painful. Some people just never make this connection, or maybe you're having some pain in the feet, especially around the big toe area, and you haven't correlated with anything yet. This can not only be a painful process, but it can also signal that your blood pressure might be up, or your blood sugar might be off, or you're maybe having problems with your kidneys. A quick remedy for uric acid increasing in the body, or for having gout in general, is actually baking soda. If you put half a teaspoon to a teaspoon in baking soda, and you could do this multiple times a day, around or during a gout flare-up, or when you're having this higher acidity, it brings the blood and the digestive tract more alkaline, which helps level you out. It's really cheap. It's really easy to do. You certainly wouldn't want to do it long term, but for a week or two period of time, you can go ahead and add that in. Be leery if you are in a high blood pressure situation that you're not over consuming sodium during that time, but baking soda might be an easy remedy to lower that gout flare-up and the acidity in your body. Number five, the color of your potty. You can tell that I'm a dad with 3 little kids, huh? I call it potty. Your pee, your urine. What does it tell you about it? If you got to go all the time, that's an easy indication of a UTI, some kind of infection. If you haven't drank a lot of water and you don't have diabetes, all right, and you're going to the bathroom a lot, you might have an infection going on in there, especially females. But it could be a sign of diabetes. That is an early warning sign of it. Or maybe you just drink a lot of water and you're letting that out. Now, what your urine also tells you, or your potty also tells you about what's going on is if it's pink, that's an infection. There's some blood showing up in there. There's some irritation going on in the kidneys or in the tubules that carry the urine out of your body. So look for it to be pink. That's what's going on. Real cloudy, dark, that's dehydration. Drink more water. You don't want cloudy, dark urine. We need to be absorbing that water in. Half of your body weight in ounces each day is what you're looking for. And if it ever turns up cola colored, like real dark, starting to get to like, Coca-Cola colored, not good. Your kidneys are being damaged. You may have muscle damage as well. That would be an emergency to seek out some medical attention. But your urine can tell you a lot about the status of what's going on with you, your energy levels, how dark is it? Maybe you need to drink more water or be looking for those infections. Number 6, your mouth is burning. What's up with that? If the mouth is burning in there, you may have a couple of different things going on. Number 1, it could just be that you have dental work. If there's metal in your mouth, then you need to pay attention to that because it creates different allergies, different rejections to the metal. It also accumulates more microbes in the mouth itself, and that can create micro imbalances in your whole digestive system tract. So this could be a warning sign that the digestive system has a microbial imbalance, and then that creates an inflammatory response. So it can lead to autoimmune related conditions. It can lead to weight gain. It can lead to candida imbalances or other microbes overtaking it. So you'd really want to pay attention to doing a proper gut reset. I did a training on taking care of your gut from mouth all the way through, and you can check that out in the description below to get some more help on how you deal with the gut, especially if the mouth is burning. Address your dental health, address any metal that's in there that may be in there, and avoid doing that if possible. Do proper oral care and then start addressing your gut. Number 7 is a lump around the belly button area. It might be a large bulge, small bulge, and I'm not talking about the belly button itself, but around that area is the lining where your abdomen connects and organs or other tissue can herniate through. So a soft bulge around this area is called an umbilical hernia. It signifies a weakness in the abdominal muscle. This is very common in women post-pregnancy, men that have gotten overweight, women that have gotten overweight, and we really need to focus on core muscles and pelvic floor muscles. And so inside our lifestyle member area, we have an entire training breaking this down and a whole process to go through, but you really want to focus on your core and your pelvic muscles to really strengthen that back up. If that herniates through and continues uncontested, nothing's done about it, you can actually have part of your digestive tract poke through there and it could cut it off and create more problems. We don't want that. You just need to get back to creating more of a six-pack, more of those abdominal muscles to prevent it. Number 8, frequent canker sores. If you're consistently getting them showing up, one now and then, here and there, you might just need more zinc in your diet. You might be run down immune system wise. But if you're consistently getting canker sores here, that is squealing trouble for what's going down below. This is poor gut health. Your digestive system is struggling with the microbials, with the inflammation, digesting your food, and the mouth, the beginning of your digestive tract, is telling you the warning sign of it. So lots of canker sores here means you really need to start cleaning things up here. That's exactly why I put that gut health starter training in the description of this video right here. So go click on that and check that out. Frequent canker sores, getting to the cause means taking care of your GI system. Number 9 is thinning hair, especially with the eyebrows, one that's not talked about as much. But when the hair is thinning, the number 1 culprit to look at is your thyroid. But if your eyebrow hair is also thinning and you're like, I don't have to really trim those back anymore, or I'm not really doing anything with them, especially for females, right? You may look at an underactive thyroid. All right, the thyroid's not properly working. It's not kicking out the needed blood flow, the needed nutrients to help support hair growth in the areas that you do actually want it. To break that whole subject down to help you to understand it if that is you, I also put an entire thyroid training in the video below. So you can click that link. It'll take you to understanding the thyroid, what needs to be done, what to eat, what not to eat to help you with this thinning hair issue. Number 10, you bruise easily. Just doesn't take much. Hit your leg on something and you get a bruise. That is a telltale sign of vitamin C deficiency. Simply getting in more lemons, more limes, more strawberries, more oranges. Stay away from concentrated orange juice. There's too much sugar. Or supplementing with a solid vitamin C supplement. High dose would be recommended. Taking small amounts of it throughout the day would be a really good idea to bolster that water-soluble vitamin back up, and then taper your way down, but consistently get vitamin C in every day. You need to take it back in, or you really get depleted over time. So I put a link to the one that I use. The key to it is using bioflavonoids with it. That's what helps drive the absorption of the vitamin C in the body and make it more useful for you. Number 11, itchy skin. Just consistent itches on the head, maybe on your arms or your legs. That itchy skin can be a big warning sign that one of your main filter organs is struggling. Your liver. There's not a lot of warning signs when it comes to liver health, but liver damage, cirrhosis, fat building up in the liver, not a good thing, and it can really sneak up on you. And here's the bad news. Over 50% of Americans are dealing with it right now. There are a lot of warning signs when it comes to liver failure. And if that one goes under, every organ is significantly impacted. Your weight is significantly impacted. It is not one to mess with. So if you really want to learn the telltale warning signs of liver problems and then what you can do about it, I made an entire video training and I put that right here to help you out as the next step.